Welcome to the Skip channel and subscribe the channel. Today we will see the anatomy of the humerus bone. First we will see the side determination of the bone. The upper end is the rounded, then lower end is the expanded and side to side flattened. Then second one is the upper end directed medially and upward, then backward. Then there is a lesser tree buckle in front of the head. This is limited laterally by the bicipital groove. Then we see the features of the bone, upper end, shaft, then lower end. First we see the what are the features in the upper end. This is head of the humerus. This one crater tubercle. This one lesser tubercle. This one anatomical neck. This is intertubercular sulcus. This surgical neck. This one crest of the crater tubercle. This is crest of the lesser tubercle. These are the features of the upper end. Then we will see the shaft features. First one is the deltoid tuberosity. This one is the anterolateral surface and anteromedial surface. Shaft has a three surface: anterolateral surface, anteromedial surface, then posterior surface. Right. Then we will see the lower end features. Here, lateral supracondylar ridge. This is medial supracondylar ridge. This is lateral epicondyle. This one medial epicondyle. This one is a radial fossa. The head of the radius bone articulate with the when elbow joint flex, right? Then coronoid fossa, then elbow joint flex. The coronoid process of the ulnar bone articulate with the coronoid fossa. Then capitulum, the head of the radius bone articulate with the capitulum. Then trochlea, this articulate with the trochlea notch of the ulnar bone. These are the lower end of the humerus bone. Then we will see the posterior aspect of the bone, right? This is posterior aspect. Then we will see the upper part of the posterior aspect. There is a radial groove for the radial nerve. Then this one is a posterior surface, right? This is the olecranon fossa. This olecranon fossa is articulate with the olecranon process of the ulnar bone. These are the features of the humerus bone, right? Then we will see the attachment of the humerus bone. The upper part of the crater tubercle, there is a supraspinatus muscles incision, then lesser tubercle, subscapularis muscles incision. Then in the bicipital group, there are three muscles incision: pectoralis major, then latissimus dorsi, then teres major. Right. Then in the deltoid tuberosity, there is a deltoid muscles incision. Then brachialis muscles origin the lower half of the uh, shaft of the humerus bone. Right. Then we will see the lateral epicondyle. There is the brachioradialis muscles. Then lateral condyle, the extensor carpi radialis longus. Then common extensor origin. These are origin from the lateral epicondyle. Then we will see the medial epicondyle. There is the pronator teres muscles and common flexor origin muscles, right? Then we will see the these are the anterior aspect of the bone attachment. Then we will see the posterior aspect of the attachment of the muscle. There is the supraspinatus, then below the supraspinatus, infraspinatus, then below the infraspinatus, there is a teres minor muscles. Then above the radial groove, there is the lateral head of the triceps brachii. Then below the radial groove, over half of the shaft of the humor, there is the medial head of the triceps brachii, right? Then uh, lateral condyle, there is the posterior aspect, angonius muscles origin. These are the posterior aspect of the muscles attachment. Then we will see the clinical important. First one is the common fracture. There is a sharp fracture. Here you can see sharp fracture. Then supracondylar fracture. Here you can see the supracondylar fracture. Then next one is the neck fracture. There is the anatomical neck. This one fracture. Then surgical neck fracture. Then other also greater tuberosity. Then lesser tuberosity fracture. These are the clinical importance. Thanks for watching and subscribe the channel.